All right, I do make that 10:30, everyone, so we are going to make a start. Good afternoon, sorry, good morning to you all. My name is Dave, and I'm one of the training specialists here at Ardens. Obviously, today you've registered and joined for our Getting Started with Ardens Manager. So I'm going to go through the PowerPoint first of all, and then we're going to get logged into Ardens Manager and introduce you to all of the functionality within Ardens Manager to help you sort of monitor things like your national contracts when it comes to QOF and so on. As you'll be aware, when you join these national webinars, your cameras and microphones are disabled. They are on mute, and that is intentional because the session is being recorded this morning. So we'd like to have a clear recording for everyone to refer back to. Doesn't mean you can't ask questions. So within Teams itself, you do have that Q&A icon along the top of the screen. So if there are any questions as we go through, just please feel free to pop them on there. It's just myself today, so we'll need to wait till the end of the session, and if there are any questions, we can just share them with the wider group at that time. Duration-wise, we're looking at between sort of 45 minutes to an hour. Generally speaking, it does last about an hour or so. As I mentioned already, session is being recorded. Everyone who has registered for today will receive the recording link emailed to them later on today. From a technical perspective, if there are any issues with your audio and you can't hear me quite clearly, not a great deal we can do about it with sort of traffic and internet speeds and so on. But generally speaking, we just find if you log out of the meeting, log yourselves back in, generally that will fix that audio issue as well. Just touching on the agenda, so we've got about an hour or so. I'm going to take you through one or two more PowerPoint slides, get ourselves logged into Ardens Manager. I'm going to start off with adding staff to Ardens Manager and how you can configure their smart cards to be able to see patient identifiable information, general navigation, and then mainly I'm going to use the QOF dashboard this morning just to show you all of the functionality that's available at your fingertips. Not to say that you'll use all of the functionality all of the time, but just to give you an idea of the kind of things you can use to help monitor the likes of your QOF contract as well. Just a little bit of background from us as a company. So from an Ardens perspective, essentially there's two sides to the Ardens business. We've got Ardens Clinical, which is, I'm hoping, what you're more familiar with, which is where we embed all of those Ardens templates and documents and reports and searches into your clinical system. Generally speaking, the majority of you and your team will be using the Ardens templates to capture and code information correctly. So Ardens Clinical embedded into your EMIS Web, your System 1, and that's where hopefully your team are capturing all of the correct information when they're doing their QOF annual reviews and so on and providing patient care. Where Ardens Manager steps in is what that gives us is something called a data analytics platform. So all of the data you hold for QOF, for example, within EMIS, within System 1, automatically on a daily basis gets uploaded in to Ardens Manager. So rather than having to run reports and searches manually within your clinical system, you can log into Ardens Manager and it'll give you an up-to-date picture, an overview of where you are with the likes of your QOF contract and so on. So it just allows you to monitor your performance, allows you to add targets if you need to, that kind of thing, just to make sure you're on track to maximize your income, maximize your points come to the end of the financial year. It does include patient level data now. So obviously today we're getting started with Ardens Manager. So some of you, I'm assuming, are very new to the concept. But originally when we brought Ardens Manager to the market a few years back. Yes, it had all of the facts and figures, but it didn't used to include patient identifiable information, where now it does. And that even gives you the ability, if you choose to use it in this way, to actually invite patients in for their reviews directly from Ardens Manager. And again, I'm going to give you an example or two of that as we go through. So you've got that detailed analytics insight into your patient's records directly within the Ardens Manager platform. As I mentioned, automatic upload, so nothing you need to do as a practice. We automatically, on a daily basis, upload all of your data. And it's not just QoF. I'll touch on a few other things and show you what is available. Your appointment system gets uploaded into here, all of your vaccination programs, your referral patterns. It's not just QoF, there's lots of other dashboards that are available as well. Obviously, they're all built on the rule sets and the code sets for the likes of the business rules for QoF. So again, hand in hand, you use Ardens Clinical, you use the Ardens templates, which have got those cast iron guarantees of having the correct codes when it comes to business rules for QoF and network DES and so on. Allows you to then benchmark and break down those patients. You can set your own targets, you can monitor your trends and so on. You can assign work to colleagues as well. So, you might generally be looking at this, looking at QoF. You might have other members of the team who deal with certain areas, certain registers within QoF. And if you want to assign work to a colleague or a group of colleagues, again, I'll show you how to do that and add comments and so on. And again, breaking it all down into patient level data as well. Just going to leave that for now. We're just going to dive straight into Ardens Manager and get started. So first thing you will need to do is have an account for Ardens Manager. And I'm going to show you how all that side of that works in a second or two. What we also have, just to supplement that, is on the Ardens website, we do have step-by-step guides of how to add staff, how to configure their smart cards and so on. So I'll post those in the Q&A before we finish off this morning as well. First thing you need to do is, once you've got your account activated, Ardens Manager is web-based, so it is available wherever you are 24/7. All you need to do is just navigate via your browser, app.ardensmanager.com, and that will take you to the login screen. Personally, I use Microsoft Edge for this, but whether you use Edge or use Google Chrome, as long as you go to that address, obviously pop it onto your favorites and it's always going to be there for you. Takes you to the login screen. You can see from here you've got two ways to log in, either manually with your email address or more importantly with your smart card. Always recommend using your smart card, because as long as it's been configured, then your smart card would give you access to patient information. It would allow you to, if you wanted to, send out those invitations directly from there as well. So I don't suppose you ever would forget your smart card, but if you do, you can still log in. Only difference there would be with your email address. Yes, it'll give you QoF. Yes, it'll give you your facts and figures, your numbers, your percentages, your thresholds. You just wouldn't be able to see who the actual patients affected are. So where you can, always log in with your smart card. Just need to pop my PIN number in. It's going to take a second or two. And once we're logged in, it'll just take us directly to the Ardens Manager homepage. So there we are. This is Ardens Manager. We're going to start off with how you add staff and configure them to use their smart cards. And you can do that in one of two ways. You can either, from that homepage, click on Account Settings. That'll take you to where you've got organizations. You would see your practice name on here. Garden View is my test system, my test practice. So that's where I'll be using today. So everything you're going to see is dummy data. But all of the functionality is exactly what you have at your fingertips in your practices. So if I wanted to go to Garden View to add some users, then I would just access it from here and access my users tab on the top of the bar there. Just go back to the home page. So the first way to do it is account settings. The other way, again, personal choice. Go to your name in the top right hand corner. Go down to the settings option. You're presented with the same screen. So today, let's say I'm a practice manager at Garden View. I want to add a new member of staff. So I select my practice. I go to the users tab. These are all of my users. Starts off with system admin. Now, the difference here is if you are added as a system admin, it would give you the rights to add staff, also configure their smart cards and so on. Again, we'll go through that shortly. Whereas if I scroll down, if I was logged in today as Rob or as Ben, yes, they've got access. Yes, they can use their smart cards to log in. The only difference would be if they came into these settings, they wouldn't be able to add or configure anything. So they wouldn't see the add button. You only get that as a system admin. It's very quick and easy to add staff, and there's no limit to it. You can add as many or as few as you need. So as long as you're a system admin, want to add someone new today, it's based on an email invitation. So all I do there is pop in the email address of the person we want to have access, click OK, confirm their details, name, drop down there for job title, little tick box. So the power's in your hands. You might want to make that person a system admin. You might not. If they need to be able to add and remove staff, you tick the box. If not, you just leave it unticked. Essentially, that's your job done. You click OK. What we do in the background is then fire off an email to that person. And on that email will be a little verification link. They click on the link. That's what activates their account, and they are good to go. You just need to configure their smart card. So adding someone, very straightforward. Pop in the email address, confirm the details, and just wait for that patient to accept their invitation. The other options you've got is, again, as a system admin, the three little dots on the right-hand side next to each user allows you, for example, you can see here, these are all enabled. Enabled for patient access means that the smart card is activated and can be used to see patient identifiable information. So three little dots. Obviously, this person is enabled, so if I wanted to disable their patient access for any reason, I could do. I can change their job title. I can remove the system admin rights for whatever reason. Most important one on here is because this is web-based, if you do have maybe a member of the team who leaves your practice, then until you remove them from here, they would still have access to be able to log in. So most important thing to do really is any members of staff leave, remove them directly from here. It just means, you know, you've got that safeguard in place. They can't log in and look at your dashboards, look at your data. Main one on here is if I scroll down and find someone who's not enabled. So there we've got Sophie. She's one of the system admins, so she could do this herself, but I'm going to do it on her behalf. Just going to click on the little three dots. So she could be logging in with her smart card, but until this is enabled, it wouldn't give her patient identifiable information. So if you try to look at patient lists, essentially it would say access denied. So what I do is just enable patient access, and that means Sophie can now log in with her smart card. She can now see those patients' details as well. A couple of other little bits and bobs on there. If I just go back into users. So important thing really is just to make sure everyone's enabled if you want them to be able to see the patient details. Only other thing on here just to maybe keep an eye on occasionally is as you scroll through your system admin and your staff members, right at the very bottom of that screen, you'll see you've got pending members, or I've got pending members, should I say. So I've got 3 users here who we've just added, or maybe added a week or 2 ago. The email's been sent, but what that person has not done is they've not acted on the email, they've not accepted, they've not clicked on the link, they've not activated their account. Their options on here, the 3 little dots, change slightly. So let's say, for example, I added Tessa 2 weeks ago. I've noticed she's still not accepted. Have a chat with her about, we've added you to Ardens Manager. We can see you've still not activated your accounts. Tessa and I turn around and say, didn't even realize that we were invited. I just deleted that email. I wasn't sure what it was about. So you can, with the 3 little dots as a system admin, resend that invitation, or again, if she's moved on to pastures new, maybe just withdraw that invitation. The important thing here is you can't enable those smart cards until that person has activated their account. So, for example, Molly does that today. She's going to move up to one of my staff members, and then I would need to come in and also enable patient access just to make sure that the smart card will work, and she'll see patient details as well. So hopefully fairly easy, fairly quick, fairly straightforward. There's not a great deal to the configuration side of adding users and keeping on top of those users who may leave your practice as well. As I say, at the end, I'll pop in a little link to our website where we've got step-by-step guides on how to do all of that as well. Once you've done that, back to the home page and you're good to go. You're ready to start doing things. One thing I just want to point out on here, and I'm guessing probably most of you won't need this currently, but this is something you will see at the beginning of each new financial year. So on the 1st of April this year, new financial year, last year's QOF contract, for example, will have expired. It'll be archived. It's still available in Ardens Manager, so you can still see last year's data if you wanted to review anything. But essentially, each new financial year, under this task section, what you will see is tasks that will need to be accepted. So, for example, let's say you've logged in for the first time today. You've got those tasks. It only takes one of you in your practice to accept them, and it will be removed for every other user. But essentially, new financial year, you'd need to accept QOF for 26-27, network DES for 26-27, and so on. So every national or potential local contract that you're invited to, you need to accept before we've then got the ability to upload that data daily on your behalf. So chances are that's already been done by someone in your practice, because we're sort of getting towards the end of April, but anyone can do it. If it's on here and says accept, and it's for QOF or it's for network DES, just press the button and it just means we can start to upload that data for you on your behalf. Left hand side is where you've got access to all of the various dashboards that are available. Now, again, today, we're sort of going back to basics, we're getting started, showing you all of the sort of functionality and introducing you to the dashboards. But just bear in mind, left-hand side, under the governance icon, you've got the CQC dashboard. So that hopefully is going to help you prepare if and when you get a CQC inspection. It's based on the reports, the searches that the CQC inspection team use to audit patients' records as part of that visit. So you've got a CQC dashboard, you've got quite a large number of service dashboards, everything from appointments right the way through to all of your vaccination programs. I am going to touch on this at the end, but all Ardens training is free. So after today, if you're a little bit more interested in, what can we do in and around appointments? What can we do in and around vaccinations? Then I'll give you the links to be able to book all of that free training in the future as well. So got your CQC, got all of those various services dashboards, and you've also got all of your national and potentially your local contracts on here as well. So this is where we're going to use the QOF dashboard today just to give you a few examples of what you can do and what you might want to do at your particular practice. So go to contracts, go to QOF for 26-27, and that's going to give you the new contract for new financial year, and essentially that's monitoring your performance and how many points you've generated so far out of the points that are available. Obviously, we're very early in the financial year, so the numbers for me and for you probably are going to be fairly low, but you've got various different ways of navigating around Ardens Manager. So you can see along the top here, excuse me, we've got various tabs that will lead you to those sort of, areas of QOF, those domains that you might want to concentrate on. So today, for example, in my practice, if I'm interested in where are we with dementia, where are we with respiratory, then again, personal choice. I could use the dementia tab. All that does is just filter everything else out. I'm just dealing with my dementia register. I know for a fact I've got 0 points, which means when it comes to the likes of the indicator dementia 04, It just means that, in my practice, we've not done a great deal of work yet because we're very early on in the financial year. But what that does give me is the dark grey bar to let me know where we are in terms of sort of progress and achievement. So based on how you've coded those dementia care plan reviews in EMIS Web, in System 1, that's what your evidence is. That's what's being uploaded directly into here. It then gives you the lower threshold. So until you generate more than 35%, you're not going to be earning any points. So you've got the minimum threshold on here, the maximum threshold. Got a little bit of a spark line here just to show you what your improvements are like. Got the actual thresholds just documented there if you need to see them. What your actual percentage achievement is, how many points you've generated, how many patients have had their reviews, and again, coded correctly, how many points remain, and then more importantly, this column here can be used in one of two ways. Essentially, it's telling me to get to maximum points, to get to 70%, I would need to do another 31 more patient reviews, care plan reviews this year to hit that maximum target. If I wanted to flip the switch on that and say, well, how many will it take to get to at least minimum points, because maybe it's easier to deal with a smaller number of patients, and I can change that maximum to minimum. And I now know I've got 15 patients that would get me to those minimum targets. If I want to delve in a little bit deeper and look at that sort of data analytics side of that and break down demographics and conditions and all of these other kind of things, essentially the magic button in Ardens Manager is just the view button. So go to view. I can see benchmarking on here. So what we can do is show you or display the benchmarking across the PCN. It's optional. You don't have to have that, but maybe nice to compare yourselves with your neighbouring practices. Obviously, you can't see their patients. They can't see your patients. It literally is just the numbers for that particular indicator. If you want to see who those patients are, so I've got 47 patients on my register. 2 of them have been seen. 31 of them would get me to maximum points, get me to 70%. Go to my patient tab, and because my smart card's been enabled, that's what gives me access to those patient lists. Now, you'll see on here, at the moment, it's showing me achieved and remaining. So it is the dementia register, and of those patients on the dementia register, which ones of them, should I say, have been achieved. So for me, I've got 2 patients, so there's 1 with a green tick. So I know that that particular patient's been coded in your clinical system to say that they've had the dementia care plan reviewed. If I want to flick through page 2 and 3 and 4 and so on, I'll find that second patient who's had their review as well. Probably the important one on here is if you wanted to start thinking about how do we target these patients, how do we maybe set ourselves some targets to deal with these. Just going to go back to the benchmarking. So for me, I know it's very early in the financial year, but I know I've only done 2 out of the 47 patients. So again, I'm quite a way off that, minimum target. I'm quite a far way off that maximum target. Now, what you can do, and again, this is just personal choice. I'm not saying you would use this on absolutely every dashboard, absolutely every indicator. But if, for example, last financial year, we missed out on dementia because we didn't quite get to that 70% mark, what you can do on here, on all of these indicators, is you can add targets of your own. So if you wanted to target something, monitor your progress, have those conversations with your clinical team around, hopefully by the end of Q2, we're at 50% or whatever the case may be. So I'm going to add a target. Just going to use today's date as being our start date. I'm going to say currently it's, I don't know, 4%, I guess. So we're at just over 4%. So the start value is 4. Go to the end date. Now, again, this is entirely optional as to how you want to work, but you might think, well, actually, if I think about this logically, come the end of September, it's going to be the end of Q2. We're going to be 6 months into the financial year. So in my mind, my practice should be at that 50% level at the end of September. So my end date for this, I'm just going to cycle through here to the end of September and say, actually, what I want to do is I want to be at that 50% mark by the end of September. Can you see it's put a little dotted line on your graph there? So again, as you come in regularly to Ardens Manager, you would see over time whether you've still got some way to go to achieve that deadline of the 30th of September, or you might already have surpassed it. Again, entirely up to you. You might think, well, actually, our target would be by the end of Q3, so end of December, we'll be going into the sort of final quarter of the financial year. So on the 31st of December, I want to be at that 70% level by that point. So I'm not running around like a you-know-what come January, February, March of next year. You can aim higher, so you might want to go to 80, you might want to go to 90, you might want to go to 100%. It's entirely up to you. But if you use the minimum, maximum thresholds, I would know if I save that when I log into this, regularly over the coming months. It might be that I get to October and I'm already at 75%, which means my time's going to be better spent on those indicators where there is room for improvement and we do need to maybe set further targets and so on. So just functionality within Ardens Manager allows you to add those targets. As I say, it's a dotted line on here, and that orange line there is you or me as Garden View. So again, over time, that's going to sort of plot against that dotted line, and hopefully it just gives you that guide to try and surpass those targets as well. At any stage, if I wanted to edit that and change the date or the percentage, or if I want to delete that, I could do. So if I wanted to edit, it's just a case of, do I change the date? Do I change the target percentage? Or if I wanted to, I could just delete that once I've passed the target, once we know we are on maximum points for that particular one. So at any stage, doesn't matter where you are. So I could be in respiratory. I could look at some of these. I could look at some of my asthma ones. So again, very early in the financial year. But for me, I need 35 patients to get me to maximum points for EST 15. If I wanted to see how many it would take me to get to minimum, I can flip the switch. I can see it's 23 patients, and I could, again, view and potentially, again, just add one of those targets just for my practice to say, come end of Q2, end of September, I'd like to be at least at that 50% mark, and that's going to hopefully give you something to aim towards. Just going to go back to the dementia one because I've got a little bit more data to play with on that one. So back into dementia, and then again, if I wanted to see my patients now, go to view. So we're looking at those that are outstanding for the dementia care plan. So I'm going to go to view. I'm going to go to the patients tab. This has shown me everyone, the register, who has had the review, who's not. More importantly, what I want to do is just show my remaining list of patients, because that's the ones who do need to be seen this financial year. So show remaining only. And what you then get on that right-hand side is all of the breakdowns of all of the data metrics. So again, rather than having to do anything in System 1 or EMIS Web, because the data is coming directly from there, we can automatically give you that demographic information. So age, gender, ethnicity, health inequalities, health deprivation, and so on. We've got a map now built into here. For something like this, dementia patients, maybe they do need a visit rather than inviting them in, however you would do that. So if I wanted to see on a map where those patients live, initially what you'll see is the practices within the PCN and how many patients there. But what you want to see is this one here. So use the little drop down, patient LSOA breaks it down by postcode, and there you've got in those postcode areas where those patients live. So whether it's for dementia and you want to organise visits, or whether it's maybe organising an outreach clinic to see those patients elsewhere, just gives you a little bit of a heads up as to where those patients live within your practice boundaries. It also gives you a breakdown. So all of these patients, 45 in total, who are on the dementia register, have not had their dementia review. If I'm interested to see what conditions they also suffer from, again, I'm not having to do anything back in my clinical system, because here it's taken all of that data from EMIS and System 1, gives you initially that overview. So you can see, how many have got cancer diagnosis, CVD, and so on. And then if you're more interested in specifics, scroll down and it'll just break it down by the coding that you've done in your clinical system as to how many patients on, they've got these diagnosis codes on their records as well. You've got all of the risk models built into Ardens Manager now as well. So if you're interested in bridges to health or continuity of care. So again, at a glance, I know 26 of those outstanding patients have got a red continuity of care flag on their record. As I say, bridges to health, continuity of care, you've got Q cancer, Q risk, Q admissions, and so on. Obviously, your organisation is just you as a practice. Your staff is not going to give you a great deal here, because these are patients that have not been seen. But if I just change that to achieved, so these are the 2 patients that have been seen. So this might be something that you can do as a practice to monitor workload. So for my practice, it's Marie who's done those 2. Again, in reality for you, with a lot more patients and so on, you'd be able to see who's doing the majority of the work. Resource works for you if you use System 1 as a clinical system. What that will do is it will give you information around the templates that captured that data. So again, from a training perspective, from a practice perspective, you want everyone to use the Ardens templates. If you're using System 1, it's going to show you which templates have been used to capture that data. Unfortunately, it doesn't have that functionality for EMIS, but I believe we are still in talks with EMIS to be able to configure that and bring that information through as well. A little bit further along, you've got a timeline. So again, for those that have been achieved, if I was interested in when was that work done, obviously it just plots it on a chart here, but you've got that little drop down where you could look at, when did we do that? What days of the week? What weeks of the financial year was that recorded in? What month? Quarter. So it just breaks it down to allow you to see. So again, if you got to maybe Q3 of the financial year, you might be aiming to do as much as possible by then. And this would show you, for example, Q1, we did 10 reviews. Q2, we improved and we did 20. Q3, we did the final 10 patients, which means we're at that maximum points level as well. And then finally on there, you've got your rules. So within here, obviously, goes without saying, all of the reporting in here is based on what you do in your clinical system and how you code that dementia care plan. Essentially, these are the searches, these are the reports that are being built into Ardens Manager. If you ever need to know what codes are in the business rules, if you maybe look at this in the future and think, I'm sure we've done more dementia care plans than Ardens Manager is showing us, Ardens Manager can only show you the code and info based on the correct codes that you use within your clinical system. So if I'm interested in what codes are used for dementia care plan, click on that little link, DMCP, click on it a second time, and I now know the only 2 codes that are eligible for that area of QOF for those points: dementia advanced care plan agreed or dementia care plan agreed. So again, if your clinicians are going out and doing a review, coming back to the practice and just coding, I've done a care plan review, yes, it's a code, but it's not the code that would qualify. So you wouldn't be eligible for your points because you've not adhered to the business rule codes, basically. So that data metrics on the right-hand side pretty much gives you everything you need. I'm just going to change this back to remaining only. So these are my patients. Few things above and beyond that you can do on here as well. If you're interested in, I need to look at this patient's record in EMIS or System 1 to see, is there the potential that they had a visit last week, but when the GP came back to the practice, he or she forgot to update their record, forgot to code the fact that they've done a dementia care plan review. So you can copy their NHS number, take that NHS number into EMIS or System 1, review their records, and then, make any sort of data quality kind of issues. Maybe we do need to add a code, maybe we do need to prompt that GP to add a consultation and use the Ardens Dementia template to capture that. So that's one way of doing it, just manually copy the NHS number, go into EMIS or System 1 and review their records. Other way you can do that now is you do have a view option. And if you click on the view option, top right-hand corner, my garden view thinks of itself as an EMIS practice. So I do have the option to open in EMIS. Obviously, if you're using System 1, it's going to say open in System 1. You do need a piece of desktop software for that to work. And if you've not got that installed, just contact our support team and I'll show you how you can do that a little bit later. But essentially, click on open. That's going to log you into your clinical system with the patient selected, so you can see, again, is that the patient who's been seen but just not being coded correctly, or whatever the case may be. You've also got a newer option on here as well where you can check that patient, so you can check to see why they've been included in that report. I know within EMIS Web, within searches, there's a check patient functionality which does the same thing, but it'll say, this patient is either in this report because yes, they have had their review, or no, because they've not had the review. So it's just checking to see why that patient's in there, and you can do it either from here or bottom of the screen. You can pop an NHS number in of a patient and it'll tell you if either yes, they have been included, or no, they haven't because they've not, for example, had the dementia care plan code added. So navigate around the records, do whatever you need to do. Got all of the data metrics on the right-hand side to do that as well. The other thing you can do is if I just take a step back from this one, and again, we'll just deal with this dementia criteria at the moment. So I'm looking down here. Maybe I have already viewed and seen who those patients are, but maybe at my practice, what I want to do is assign that work to a member of the team, or potentially to that clinical lead who's in charge of the dementia patients. So what you can do is you can assign, you can allocate, you can forward that information on to a particular user or a group of users in your practice. So again, if and when you need it, I might look at this today, I might have already been through the view option, I've seen who the patients are, I've only dealt with the remaining. Again, I've looked at their demographics, I've looked at other conditions and so on. But what I might want to do, so I'll just go back, is I might want to assign that to either my lead GP or maybe someone in the admin team who's going to organise the visits or whatever the case may be. So right-hand side, you've got an assigned icon. So if you assign this, so I'm going to assign this to myself just so you can see how it works in reality. So there's my list of users. So I could search for my name at the top there if I wanted to, but I'm going to assign it to me. What you'll see in the background is a new task's been generated. So what that means is, let's say in my practice today, someone allocated DEM04 to me. I might not currently be logged into Ardens Manager, but I am going to be informed, and I'll show you where that is in a second or two. But you can assign it to as many or as few people as you like, really. So you can assign it to as many or as few. So you can have either a group or you can have one individual. So you can assign that work. So you can see here, it's been assigned. What you would also get is, let's say, for example, if I go right the way back to the home page, let's say I've logged in today and I've been assigned something, I wasn't aware of it. On my home page, under my tasks, it's going to tell me I've got a review to do, so I can get access to it from there directly. If I just miss that for whatever reason, then I go into contracts, go into QOF. If I look on the right hand side, I can see I've got that review. So click on there, and I now know Dementia 04 is being allocated to me. It's my responsibility to organise those visits, to get those patients seen, over the next month or two, or whatever your time frame is, really. So just allows you to assign and allocate, share the workload with your colleagues. You may not use that on every single one of these, but if you've got the ability, if you've got the luxury of saying, this team are dealing with that indicator, this team or this person is dealing with this indicator, it may just help share the workload a little bit. Other way I can do that is, again, if I've missed that, if I go to just on the QOF dashboard, the filter option, and I want to filter by what's been assigned to me, then again, it just takes me directly to that Dementia 04 because it knows me and some of the other team have been allocated to that. Now, one way of dealing with that and using that in reality would be, go to view, go to my patients. So my responsibility today is to start organising those visits, getting those patients reviewed over the next month or two. I'm going to show the remaining only. I know I only need 31 to get me to maximum points. In total, I've got 45. So ideal world, we want to see all of them. Again, I've got those breakdowns, age, gender, ethnicity, and so on. Got those conditions, got those risks. Now, depending on the numbers you've got here, and depending on the numbers it would take to get the maximum points, you can use those demographics, those conditions, those risks. And what I mean by that is if you've got on one of your indicators a list of 299 patients to get to maximum points, what you might not want to do is organize all of those invites all at once because you might not have the capacity to see those patients all at once. So what you do have quite usefully on here is a filter option. Now you can filter, as I say, on demographics, conditions, risk, and so on. So this would just allow you, if it's relevant to you, to prioritize a group of patients first. So if you do want to use this as, let's deal with patients who are, frail or, particular age range or have got a particular condition, not just dementia, they might also be on the respiratory register. And what you can do is go to filter. I'm just going to mix and match a few on here. So I'm going to say my priority is those over 80s. Again, I could use gender. I could use more than one age range if I really wanted to. So I can mix and match as much as I want to there. If I then go to risk and I say, well, my priority would be those ones that we know have got complex needs because they've got a Foundry continuity of care score reds. I might also think, well, actually, my priority from a conditions point of view would be diabetes. So again, mix and match. It's up to you what you decide your priority is. But then when you apply that, you've still got 31 patients to get you to maximum points, but I've now got 7 patients who are my priority. Those are the ones we want to deal with first. Those are the ones that you want to carry out those care plan reviews and visits and so on. Now, the next option I'm going to show you is I'm not going to suggest you would use this for dementia patients because it just wouldn't be appropriate. But I did touch on it very early on when we talked about how you might want to invite patients from here as well. So what you also have in Ardens Manager is when you're looking at your patients list, whether it's the list in full or whether you've applied a filter, bottom here you've got an export option. You can export that in one of 2 ways, either as a CSV or directly import it back into your clinical system. CSV is the format that third-party text providers use. Again, these are dementia patients. We're not going to invite them in by text, but any other indicator that you apply this to, you could export that as a CSV. There's the file that's in the format that Accurix, for example, use. So you could, on any other indicator, export that list of patients, drop it into Accurix, send out a batch invite, job done. Obviously, we wouldn't do that with dementia patients. So, alternative there is once I've exported as a CSV, which again, is the format to do a text message. I'm not going to do that, but what I am going to do is just open up that file. And again, this is me as a practice manager doing this. And what I might do is then just email that to relevant member of the team in reception who's going to organise those visits for those GPs to go out and do the dementia care plan. So even though it's a CSV to do text messaging, it's still just a file. So you could open it, you could share that, you could do whatever you need to do to get those patients seen. Alternative to that is got the export button. Again, it's in EMIS Web for me. Yours is going to say System 1 if that's what you use. But that would allow you, for example, export that from here. It's in the right file format to be imported into EMIS Web. You'd have to import it into your population reporting module. It's all, I'm sure you've done this before, but it's almost like just importing another search or a search somebody else has given you. So you import that file. And it might be more appropriate once you've got that list of patients in your searches or your reports in System 1 to do a mail merge and do an invite. Similarly, with System 1, you could export the list from here, import it into your clinical reporting module of System 1. And if you wanted to use that inbuilt comms annex functionality to email or to text or to send an invite letter out to those patients, you could do. So it's just flexible enough to actually think about your invitation processes from here rather than going back to your clinical system and using existing searches or having to create new reports. It's all here. It's telling you, these are my dementia patients who've not had their care plan reviewed. This is my priority list. And I'm then going to share that with my clinical lead. So I'm going to email that file to him or her, and hopefully they'll come and do those visits over the coming weeks. Again, you're going to see the evidence of that because your figures are going to improve and you're going to hit your minimum, hopefully your maximum targets. And a sort of final little sort of bit of functionality on there as well is if you do choose to assign, or whether you choose to assign or not, you do have the option to also add comments within here as well. So it might be, using that scenario, this has been assigned to me today. I've got my priority list of patients. Maybe I have shared that with my clinical lead. What I might just want to do is just document that. Don't have to put any times or dates on it because it's going to be date stamped anyway. So that might just be my order trail. If I was assigned something, I carried out my responsibility today by getting that priority list, getting that emailed over to my clinical lead. And once I've done that, that's going to be saved in the order trail within here. So when you're viewing something, so I'll just use that DM04 again. So when we're using the dashboards, I can assign it either from here. So I can assign and unassign. When you're dealing with that and you're doing that work and you're carrying out that responsibility, again, just deal with remain and only. You'll see here in the top right-hand corner, it's there. So I could assign from this screen rather than the first screen if I wanted to, but this is a screen where you've got your comments and you can add that running commentary of, maybe I come back in a month's time and I, invite another 2 patients that are going to get us to that minimum target. So again, just order trail, what you've done and when, so you've got that information to hand. If, not yet that you would be, but if your practice manager or someone questions, what have we done to achieve this because we're still a little way off maximum points, then you could come back in here and say, well, actually, over the last few months, we've done X, Y, or Z. Yeah. So just a good way of documenting it, keeping the information in one place, really. Just a couple of, we've got a little bit of time, everyone, but 1 or 2 other little bits I just wanted to show you as well. So all of that I've done basically from those direct tabs along the top. So That's one way of doing it. The other way, and again, it's just personal choice, it's how you prefer to navigate. Other ways, rather than use those tabs along the top, if you come down to this clinical activity section, this is just all of your QOF, all of your indicators. If you want to see everything together on one screen, then you can show all 99, and there they all are. It's traffic lighted, so you can see at a glance. Red, obviously, when you're below minimum target. Amber, when you're between targets. Green, when you're above maximum target. Beauty of using this view is under that achieved and remaining to achieve, all of these columns can be sorted in order. Again, we're very early in the financial year, so we've not got a lot of data in here. But if I wanted to see what my highest percentage achievement is, where have we done really well? Are there targets that we're almost reaching already? Then if I go to percentage achieved, puts it in sort of ascending and descending order. So I now know, without having to do anything in my clinical system, that for that indicator, I'm already at 86, almost 87%. I know I need 69 more patients to get me to 90%. Obviously, the sooner you hit these targets early in the financial year, the better. So it means you can concentrate on those ones that might be a little bit difficult, get those patients involved and get them invited. So again, just by using the sort options, I can see exactly where we are. And I can see, for example, for this one, if I need those 69 patients to be seen for a BP, or maybe I send them out a batch text to inform us of a home BP reading, then I can view, see who they are. Again, I'm just dealing with the remaining only because that's what's going to get me maximum points. Got 69 of them. Again, I might decide that, you know, we'd like to invite a particular age group in first or whatever. Or if I just wanted to do a batch invite to all of these patients to say, please book an appointment for BP, export it from here as a CSV, drop that into Accurix or iPlato and do a batch invite. So again, you could add comments there to say, you know, we've invited the remaining 69 on today's date, whatever the case may be, whatever helps you to get your maximum points, really. Let's go back to that overview. And again, the way that you might use this as you go further into the financial year, show all, as I say, they can all be sorted in order. So again, you'd probably want to be able to sort by remaining points to see which areas are the ones that we're finding difficult, or we maybe need to concentrate more on, or we need to discuss with the clinical team. So go to points. Again, it's putting it in lowest order. Click on it again in highest order. So I know cholesterol 04 is my biggie. Still got the maximum 44 points to go. But again, at a glance, I know there's 123 patients that would get me there. So putting them in order just allows you to maybe, as a practice, you might not start at the top. You might just cherry pick and think, well, let's look at, let's try to find a smaller number. Excuse me. There's the one there. So for me, DM14, diabetic education referral within 9 months of diagnosis, 10 more patients here and now would get me to 90%. So again, to me, that would be a quick win, something we could probably make progress on today by at least finding out who those patients are. Remaining only, I only need 10. I've got, what, 11 in total. So for me personally, I would export that. I would then batch invite them. Again, I'm not saying this is going to happen to you, but I've seen it previously where, you know, you might look at some of these patients and think, well, I'm sure that patient had a review last week. They may well have done. Whoever's seen them, nurse, doctor, may have not used the Ardens diabetic template. They've therefore missed the fact that they needed that diabetic education referral. So sometimes it's not that you've not done the work and provided the care. It's just the fact that it's not being coded correctly, which obviously means you're not entitled to QOF points in that situation. So sometimes maybe a little bit of detective work and you go back and work that out with that person that missed those points, basically. It's going to go back to the PowerPoint to finish off on everyone. But that's what we've dealt with today. So obviously, initially we spent that time on looking at adding users, configuring the smart cards for patient identifiable, all of that general navigation. Obviously, we use the QOF dashboard, but all of that functionality where you can add your own targets, where you can assign to particular users, where you can comment, all of the demographics, the conditions, the risk that it breaks down for all of those patients. Being able to copy their NHS number and go into your clinical system and review their records. Being able to open that patient's record directly from Ardens Manager if you've got the desktop software to do that. Filtering all of that information down, so dealing with the remaining only, adding your own priorities and filter by age or condition or risk to get your list of patients that you want to prioritize first. So all of that we've dealt with. Just to finish off with training side of things, let me just work through here. So from an Ardens point of view, all Ardens training is free, whether that goes for Ardens Manager or whether you need training on Ardens System 1 or Ardens EMIS. We do, the majority of our training is done remotely now via Teams. So after today, if you or any of your colleagues need any further training, I've got a slide in a second or two that will give you all of that information as well. All you need to do is get in touch. We can arrange either in person, so if you'd rather have one of us at your practice, all you need to do is request, or if you prefer just to do an hour-long session online, we can do that as well. Keep an eye on our website because we do have regular national webinars that we run, like today. Next week, I believe, Tuesday, we've got the QOF 26-27 webinar for System 1. So that's on Tuesday at 1. And following that on Wednesday, we've got the national webinar for EMIS users for QOF 26-27 Wednesday at 1. We've also got an online training platform called Ardens Academy. Again, free to use. All you need to do is sign up with your email address. And that just allows you to do learning online in your own time, at your own pace. It is good. It's really interactive. We have sort of built-in quizzes with those. We have certificates at the end of them. Lots of support articles on our website, very dedicated support team who are, very reactive to any questions or queries you might send through. For those of you that may be Facebook users, you've got those Ardens EMIS, Ardens System 1, Ardens Manager chat groups on EMIS that you can join and keep abreast of things as well and post questions if you really need to. Everything I've just talked about there, training, Ardens Academy, support articles, and so on, is available via that QR. So if you do have your phones at the ready, if you click on that QR, it'll take you to one area of the website where it gives you the link to book further training, gives you access to the support articles, and so on. Final little slide is, if you do have the time, if you wouldn't mind just taking that QR code and submitting any feedback on today's event, today's session. It doesn't look like there are any questions on the Q&A. If anyone does have a question, if you wanted to raise your hand, I can unmute your mic from this end. But if not, thank you for joining, everyone. You are free to leave, so you've got the big red leave button in the top right-hand corner. But once again, thanks for your time. And if there aren't any further questions, take care of yourselves. Thank you.